Hey everyone, Nicola here from Marryatville Chiro. For today's Wellness Wednesday, I thought we would talk about plantar fasciitis. Just seems to be something that's popping up a lot quite lately in my patient base. So let's talk about it and let you know what it is. Pretend this is my foot, my ankle, and my leg. On the bottom of your foot, you have a thick sheath, fibrous sheath, and that is your plantar fascia. And when you have plantar fasciitis, you have an inflammation of this sheath. So it connects into your Achilles tendon, which connects into your calf muscles. So there's lots of reasons how you end up with plantar fasciitis. It's basically essentially multiple micro tears of the fascia over time, and it keeps healing and getting injured and healing and injured and healing and injured. So it can be if you've lived a very sedentary lifestyle and then all of a sudden now you're doing quite a lot of walking, standing, running, sudden bursts of exercise, that can cause injury to your plantar fascia. Poor shoes, so poor cushioning, poor arch support, just that puts a lot of strain on your feet and can affect how your plantar fascia functions. I think the most important one is tightness throughout your legs, so hamstrings, calves and Achilles tendons, if they're extremely tight, that's pulling and putting more torque and force through your plantar fascia, and that ends up with a lot of tension and micro tears, and that leads to your inflammation. Often it can also be linked with postural, so the way your pelvis is functioning. If there's any rotations in your pelvis, that's putting more strain on one leg, and eventually it will lead down into your foot. So some of the classic signs of it are pain right at the ball of your heel, or base of your heel, sorry, and pain when you've been resting for long periods, when you stand, or especially in the morning is the most telltale sign. When you first get out of bed, you put your foot down and it's excruciatingly painful, and then you take a few steps, your foot starts to warm up and the pain dissipates. That's a good sign that you have something going on with your plantar fascia. So my basic sort of go-to protocol for plantar fasciitis is we want to do some calf stretching and some Achilles stretching and some work on the plantar fasciitis, or plantar fascia. So if you take a tennis ball, put it on the floor and massage the bottom of your foot, roll it deep into that plantar fascia, get the blood flowing, warm up the area. That's something you can be doing heaps. If you're at a desk, do it while you're at work. At the end of the day, in the evening, if you're watching TV. And the next two stretches are calf and Achilles. So if you want to lunge into a wall or something, so you're going to bend your front knee, keep your back leg straight, and try and keep your heel close to the ground. And if your back leg is straight, you're stretching into your calf. If you bend your back knee, you're stretching more into your Achilles. So if you could do those stretches, hold for about 30 to 60 seconds, and ideally do them both sides, even if you have one unaffected and one affected. It's good to keep your body balanced. So do it both sides 4-5 times a day. Really, the more the better, especially if you're getting those signs and symptoms of plantar fasciitis. There's heaps more you can do, especially if those don't do much. It means it's been there for a while and it's much more of a concern or a condition. So definitely, if you're showing any of these signs and symptoms, do these basic treatment protocols, but give us a call here at Marryatville Chiro and we can give you some more specific advice. Okay, have a great day and I'll see you next week. Bye.